Okay, so first, to start us off, we're going to do the pectoral muscles. So we've got the superficial pectorals. They start at the first 1 to 3 sternobrae, and they run along his chest here to the greater tubercle of his humerus, and it adducts the limb, so it pulls it towards his body. Then we have the deep pectoral muscles, and those ones run along the sternum and also attach onto the greater tubercle and a little bit on the lesser tubercle of the humerus. And this one also adducts the limb while also pulling it caudally. All right, next we have the brachiocephalicus group of muscles, which is broken down into the cleidobrachialis and the cleidocephalicus. So the cleidobrachialis originates at the clavicular intersection and inserts on the cranial humerus, and it moves the leg forward while also extending the shoulder. Then the cleidocephalicus, that inserts at the clavicular intersection and runs up to the dorsal neck. And that also helps propel the leg forward while extending the shoulder and moving the head and neck laterally. Now we have the trapezius muscle, and the trapezius muscle originates along the dorsal aspect of the neck and the thorax and runs along to the spine of the scapula. So you can feel that right here. And then the trapezius muscle elevates the leg and adducts it, so it brings it towards his body. Now we have the rhomboideus muscle. It originates at the nuchal crest of the occipital bone along the dorsal neck and the first 7 thoracic spinous processes of the vertebrae, and then inserts on the dorsal aspect of the scapula and elevates the leg. Then we have the latissimus dorsi, and the latissimus dorsi inserts on the last 7 to 8 thoracic spinous processes and the lumbar spinous processes, goes across his body and inserts on the teres major tuberosity of the humerus. This extends the limb caudally as well as flexes his shoulder. Next we have the serratus ventralis, which could be broken into 2 parts, and it kind of looks like a fan. So it originates at the cervical vertebrae and the ribs, along here and here, and inserts on the dorsal medial aspect of the scapula, so on the inner part of the scapula, and it supports the trunk as well as depresses his scapula. Now we have the sternocephalicus muscle, and the sternocephalicus muscle originates at the sternum. It goes up and it inserts on the mastoid process of the occipital bone as well as the nuchal crest of the occipital bone. It draws the head down as well as moving it laterally, side to side. Good boy. So here we have his parotid salivary gland just ventral to his ear. And then just ventral to that, we would have the mandibular salivary gland. And then just a little bit ventral to his mandible, we have the submaxillary or mandibular submaxillary lymph node right there as well. Now we have the temporalis muscle, and this one originates primarily on the parietal muscle, but it also does originate from some of the occipital, the frontal, and the temporal. Good boy. It inserts on the cornoid process of the mandible and elevates the mandible for chewing. It also moves the mandible laterally. Good boy. Come here, get up. Good boy. Good job. Then we have the masseter muscle, and the masseter muscle is the cheek muscle of his face here. It originates on the zygomatic arch and runs to the horizontal ramus, and it also closes the mouth for chewing. Good boy. The digastricus muscle originates at the temporal and occipital bones, caudal to the external acoustic meatus, and inserts on the ventral aspect of the mandible and opens the mouth. The myeloid hyoidus muscle originates on the medial aspect of the mandible and inserts on the median raphe of the mandible in between the mandible bones, and it raises the floor of the mouth. Good boy. So first we have the prescapular lymph nodes, and those are just cranial to his scapula right here on either side. Then we have the deltoideus muscle, and the deltoideus muscle originates on the spine of the scapula and the acromion of the scapula, and then goes down to the deltoid tuberosity of the humerus, and this flexes the shoulder joint. So next we have the infraspinatus muscle and the supraspinatus muscle. So the infraspinatus muscle originates in the infraspinous fossa of the scapula, and it inserts on the lateral aspect of the greater tubercle of the humerus. It flexes the shoulder while adducting the limb. Good boy, I know I will. And the supraspinatus muscle is in the supraspinous fossa of the scapula, and it also inserts on the greater tubercle of the humerus, and it extends the shoulder joint. Good boy. Next we have the subscapularis muscle. This muscle originates on the medial aspect of the scapula in the subscapular fossa and rides along to the lesser tubercle of the humerus. This adducts the limb, so brings it towards him, as well as it rotates the forelimb medially towards his body. Good boy. Now we have the teres major muscle. It originates on the caudal border of the scapula and runs along to the teres major tuberosity of the humerus and flexes the shoulder. Good boy. All right, so now we have the biceps brachii muscle. It originates on the supraglenoid tuberosity of the scapula and goes down to the radial and ulnar tuberosities. It flexes the elbow and extends the shoulder. Next we have the triceps brachii muscle. This muscle has 3 to 4 heads depending on the species. Carnivores typically have 4 heads. It originates on the caudal aspect of the scapula and as well as the proximal aspect of the humerus and goes across to the olecranon process. This extends the elbow as well as flexes the shoulder. Good boy. Now we have the extensors of the forelimb. We have the common digital extensor, which runs along the front lateral aspect of his forelimb, and it extends the carpus as well as the digit joints here. Then we have the lateral extensor muscle. It's more lateral than the common digital, and it extends the digits. Next we have the superficial digital flexors and the deep digital flexors. So the superficial digital flexor lies along the back of his leg here, and it flexes his carpus and his digits. And then we have the deep digital flexor, which lies deeper than that of the superficial, and it does the same thing. It will flex the digits and the carpus. And here, right here, directly caudal to his stifle is where you would feel his popliteal lymph node on both legs. Boy. Next we have the tensor fascia latae. It originates on the cranial wing of the ilium and inserts on the lateral femoral fascia. It flexes the hip. Boy. It flexes the hip as well as extends the stifle. Good boy. Then we have the superficial gluteal. It originates on the sacrum and the coccygeal vertebrae, and it inserts on the greater trochanter of the femur, and it adducts the limb, it abducts it away, as well as extends the hip. Good boy. Next we have the middle gluteal muscle and the deep gluteal muscle. So the middle gluteal muscle, it originates on the lateral ilium and runs down to the greater trochanter of the femur. It abducts the limb as well as extends the stifle. Then we have the deep gluteal muscle. That muscle is deep to the middle muscle, or the middle gluteal, and this one originates on the body of the ilium and the ischiatic spine, so it has 2 heads, and it is cranial, inserts on the cranial aspect of the femur. It also abducts the limb and extends the hip. Next we have the biceps femoris. It originates at the ischiatic tuberosity of the pelvis and inserts on 3 different aspects. So it inserts on the tuberocalcaneal as well as the patella, and it inserts on the proximal tibia. This muscle is for extending the hip. It flexes the stifle, good boy, as well as extends the tarsus, good boy. Next we have the semitendinosus muscle. This muscle, it originates on the ischiatic tuberosity of the pelvis as well and inserts on the tibia and the tuberocalcaneal. It also, it flexes the stifle, so the knee here, and it extends the tarsus as well as extends the hip. And then we have the semimembranosus muscle. This also originates on the ischiatic tuberosity, and it inserts on the femur and the tibia and extends the hip. Good boy. All right, next we have the sartorius muscle. It originates on the crest of the ilium and inserts on the patella and the cranial part of the tibia. And this one is responsible for flexing the hip and extending the stifle. So this is the stifle flex and it extends the stifle. Then we have the gracilis muscle. It originates on the pelvic symphysis on the inside here, and it inserts on the cranial border of the tibia and the tubercalcaneal. And this one adducts the limb, so it brings it towards him, as well as flexes the stifle, so like this, and as well as the hip. It extends the hip and the hock, so it extends his hock. Good boy, good job. Now we have the pectineus muscle. This muscle is on the medial aspect. It originates on the prepubic tendon, cranial lateral to the acetabulum, and it inserts on the caudal aspect of the femur, and it adducts the limb, pulling it towards him. Good boy. Then we have the quadriceps femoris. So this one actually has 4 heads. So the main head originates on the ilium, and the other ones originate on the proximal proximal femur, and they run to the tibial tuberosity. Good boy. These ones then extend the stifle, so stretches it out and flexes the hip. Good boy. Then we have the gastrocnemius muscle, and this one is the medial lateral supracondylar tuberosities of the femur, and insert on the proximal surface of the tubercalcaneal. So from along here to here, and this extends the tarsus, so stretches his tarsus out, as well as flexes his stifle. Good boy. All right, now we have the flexors and extensors of the pelvic limb. So we have the superficial digital flexor that runs along the back of his leg here. It flexes his stifle. Good boy. Can flex it? Flexes his stifle and his digit joints. Good boy. As well as extends the tarsus joint. Then we have the deep digital flexor, which lies more deep than the superficial. It extends the tarsal joint. Good boy. And it flexes the digital joints. Then on the cranial aspect of his leg, we have the long digital extensor, runs along his leg here. Good boy. It flexes his tarsus. Good boy. And it extends the digits, so it'll extend them forward. Good boy. And his stifle will be extended. Good boy. All right, next we have the abdominal muscles. To start us off, we have the external abdominal oblique. That muscle originates on the thoracolumbar fascia and the last rib. So it starts here and inserts on the linea alba along the medial aspect of his abdomen. Its action is to flex the vertebral column, as well as assist in bodily functions such as parturition, urination, defecation. Then we have the internal abdominal obliques, which are more inside of the external, and they run along, or insert on the thoracolumbar fascia, and also insert, so they go from here onto the linea alba. Good boy. And their action is similar to the external abdominal oblique in that they flex the vertebral column, or the vertebral spine, and assist with bodily functions. Then we have the transversus abdominis muscle, and that one originates on the medial surface of the last 4 to 5 ribs. Good boy. And the transverse process of the lumbar spine. So from here and here, and it also inserts on the linea alba. So it originates here and along the spine here and inserts on the linea alba. Then we have the rectus abdominis, and they run along his abdomen this way, and it originates on the sternum. Good boy. And inserts on the pubis. And these, as well as the transverse abdominis, also assist with defecation in females, parturition, and urination. Good boy. All right, next we have the serratus dorsalis cranialis and the serratus dorsalis caudalis. So the serratus dorsalis cranialis originates at the thoracolumbar fascia and the spines of the first 6 to 8 thoracic ribs, and they insert in the cranial border and the lateral aspect or lateral surface of the ribs of the 2nd to 10th ribs. These ribs assist in inspiration, so they lift the ribs for inspiration, whereas the serratus dorsalis caudalis, they also originate at the thoracolumbar fascia and insert to the caudal border, but they insert at the caudal border of the 11th, 12th, and 13th ribs, and these ones draw the last 3 to 4 ribs caudally for expiration. Good boy. Then we have the external intercostals, and these are found in between the ribs. So these ones are more superficial, and they assist in inspiration. And then we have the internal intercostals. They're between the ribs, but more deep than the externals, and they are help with expiration. So those muscles assist with that. Then we have the diaphragm. So we can't see his diaphragm, but his diaphragm separates his thoracic cavity and his abdominal cavity. It's dome-shaped, but when it flattens, it allows the lungs to take in more air. Lastly, we have the epaxial muscles. So this is 3 muscles braided together. They run along the dorsal transverse section of the lumbar region. So those muscles are the iliocostalis, the spinalis dorsi, and the longissimus dorsi. And so these muscles are extensors of the vertebral column. They also allow for lateral movements of the trunk when one of the muscles contracts. And this is also a great site, so along here, for IM injections.